Well, a pragmatic route to achieving universal access to equitable, equality and affordable healthcare in South Africa is gaining support amongst healthcare professionals, workers and patient advocacy organizations as government sticks to its guns on continuing with what many may call the unimplementable, unfixable NHI, the National Health Insurance, bill. The Universal Healthcare Access Coalition says its proposed framework for healthcare reform is practical, evidence-based, capable of more immediate implementation, and critically is designed to work within the country's fiscal constraints rather than raising the tax burden on citizens. Well, let's see how it works, or at least a window into how this proposal may work. We speak to the Universal Healthcare Access Coalition Steering Committee member, Dr. Simon Strachan. Dr. Simon, good morning to you. Thank you for joining us.
The opportunity.
Dr. Simon, let's look at the current scenario regarding the NHI. The NHI, according to many, is going to have a debilitating, a crumbling effect on healthcare unless it's not addressed and readdressed in a better way. Your thoughts on that?
So if we want to deliver a healthcare service, what we're looking at is something that is affordable, fundable, sustainable, and one that ensures that the access to healthcare has equity. And once all of that is done and the systems are working well, then you can start looking at quality of healthcare, and the eventual deliverable is universal health coverage. So the objective is universal health coverage. The vehicle that we want to use to get universal health coverage. So at the current stage, yes, we are led to believe the NHI is the only way to do that. We know that it is unaffordable. The entire funding of the NHI depends on increasing taxes, and we know that South Africa is already at tax capacity. We also know that since the inception and the acceptance by the government of the NHI framework back 17 years ago, no health reform has taken place in this country, no substantial health reform. And therein lies the problem. We cannot wait for the NHI to go through all the processes, never mind the legal challenges, the processes of implementation that we have already been told is going to take decades, and have nothing done to the health system. So that's why we've come up with a suggestion, and it is a strategy framework, meaning that not everything is laid out clearly, not all the I's have been dotted, and there's lots more consultation available. And that's what we've created, is a platform for anybody and everybody to come and have a conversation and to create a document that we feel is acceptable to everybody.
Dr. Simon, the Universal Healthcare Access Coalition, I read a number of partners out there, not just doctors, but nurses and people involved in general in healthcare, patients and patients' family members as well. Who does it basically comprise of? Which role players and stakeholders represent the Universal Healthcare Access Coalition?
So the four founding members, in fact, are the South African Medical Association, the Progressive Health Forum, the South African Private Practitioners Forum, and the Radiological Society of South Africa. So the leaders of those four groups got together and discussed this option. We agreed it was a valuable thing to do because we were answering our president's call late last year for anybody who had a reasonable solution to send it to him. Remember, after what he requested, what he offered, and so we said, let's do that. So then we went out and we rallied together. We had over 50 representative groups in a discussion meeting a couple of weeks ago, and in fact, just this morning we had our 29th signatory. And these are healthcare professionals, meaning doctors, dentists, allied healthcare professional groups. We have some funding groups. We have some people from the hospital arena. We have had a lot of interest from many other groups, including patient advocacy groups who have participated in discussions. But we are at the moment saying 29 signatories, and we are still going ahead with bilaterals with some of the other groups. Now, there's a lot in this. The big thing about healthcare reform is it's very complex. And it's very difficult to kind of really make it easily understandable at first read, at first glance. So people need to really digest it and think about it and see how it applies to them. And we need to have those discussions.
So let's look at this proposal here. I mean, I'm sure it will come out more in detail, Dr. Simon. But going forward with this proposal, when do you hope to present it in front of the authorities that be, the government that be, to at least look at it and to get their feedback, hopefully?
It was presented to the President in December last year. And he sent it on to the National Department of Health. There was a small media release on around about the 30th, or I don't want to give the exact date, the second week of December last year. And then we've had a big media launch now again. So the President has seen it. And the response that we've received from the officers are that it has been perused, but there's no discussion going to take place because it is sub judice. Which is a little strange, because this is not sub judice. This is a brand new proposal. The NHI discussions around the legal challenges, perhaps that might be sub judice. But there's nothing sub judice about this. I mean, this is an open, collaborative forum. We're being as inclusive as possible. And really, that's what we're looking at. Simplistically, what we're saying is that you need to improve the private sector and improve the public sector. The public sector needs to be able to deliver better service, and the private sector needs to be better governed so that we can handle the massively increasing costs of medical care, and that is obviously affecting access. So there have been numerous reports, discussions, recommendations from people like the Health Market Inquiry about how to fix private healthcare. Let's get on and do that. The only people who can regulate that is government. In terms of the public sector, if you want to fix the public sector, we have to fix the governance, the supervisory role of independently appointed people to run hospitals. We need to take political appointments out of the system. We need to try and make sure that the healthcare that is delivered to the people that need it, and that they receive what they need, which means assessing the medical needs and the community in which you're delivering that service. So if you can do that in the public sector, which is quite possible through good management and governance, you strip out fraud, waste and abuse, you create even public hospitals that become autonomous bodies that are responsible to boards and CEOs who are held accountable by the communities. They can generate income, because in the model, you will have one section that is contributory and one section that will be free. So those who cannot afford have free access in the public sector. Anybody who's employed, and there will be a means test. There'll be a way to stratify who pays what and where subsidies go. Obviously, in terms of social insurance, ensuring that those in most need get the most help, but that there will be a contributory system, that it would be mandatory. But you would be able to access care either in the private sector or the public sector. And if you decide to go to the public sector and you're on a fund, a medical aid, well, the medical aid must pay for you to receive care in the public sector. But this is the idea, is to have this fluid situation where healthcare has been improved across the board through all of these regulatory and supervisory and governance structures, that there is going to be competition across the board, and it will be affordable. And remember, the other big thing we have to solve for in this country is critical care and emergency services. No, we have to have the situation that if somebody collapses in the streets, that whoever the nearest ambulance is picks that person up and takes them to the nearest hospital, and it's funded and they get the care they need. And that's what we're building into this kind of framework, to say, let's look at exactly what we need so that it is affordable for people. Yes, it does mean that people are going to contribute to their healthcare needs and derive that benefit. But people are more likely to make a contribution to their healthcare needs through some kind of payment, rather than to say it's going to a nebulous, endless pot of taxes. This is a specific that goes into a social insurance subsidy framework that will subsidize healthcare across the country for those in most need of it.
Dr. Simon Strachan, thank you for joining us with a brief update on that proposal, and hopefully more to come and more to hear in the weeks ahead. And thank you once again, Dr. Simon.
Thank you very much. Have a wonderful day.
Universal Healthcare Access Coalition Steering Committee member Dr. Simon Strachan, alternative to the NHI.